So I'm Darrin Beaupre, the head of early development and immunotherapy at Pharmacyclics. Today I'm happy to discuss with you some of the exciting data we have that we'll be presenting in multiple forums with Imbruvica therapy in patients with non-Hodgkin's lymphoma. The first is our study in marginal zone lymphoma, and this is an indication for which there are currently no therapies specifically approved for this disease. And in this study that will be presented by Dr. Noy at Memorial Sloan Kettering, she'll show the data of our phase 2 clinical trial. In that study, we treated 63 patients with marginal zone lymphoma with Ibrutinib therapy at the standard non-Hodgkin's lymphoma dose of 560 milligrams a day. And in that study, we showed a high overall response rate under independent review of nearly 50%, with a duration of response that had not been reached. The safety profile of Ibrutinib in that study was as expected for the compound. Basically, the grade 3 adverse events were relatively uncommon, and most adverse events were grade 1 or 2. Overall, the study showed that patients with marginal zone lymphoma benefited significantly, and based on this data, we have recently filed an application with the FDA to be the first indication ever approved in marginal zone lymphoma. The next disease I'd like to tell you about is diffuse large B-cell lymphoma. So we're currently running a trial combining Ibrutinib with lenalidomide and Rituxan. Now previously it's been shown that both Ibrutinib and Rituxan are more active in the ABC subtype of diffuse large B-cell lymphoma. So our trial combines two agents known to be active in this subtype along with Rituxan. The design of the trial is a phase 1b/2, where in the first portion of the study we determine the safety of the combination. In the 1b portion of the study, the maximum tolerated dose of the combination was evaluated, and it was found that regimen was well tolerated at the maximum dose of lenalidomide of 25 milligrams every 3 out of 4 weeks. In addition, part 2 of the study has opened. But what Dr. Gual will present at the presentation is the activity seen in the non-GCB subtype, which is the subtype that's enriched for the ABC patients. And in our trial, he will show in this subtype of diffuse large B-cell lymphoma, where the combination is thought to be most active, a high overall response rate of about 60%, with several patients having very long durations of response. And therefore, based on this study, we will proceed with the phase 2 portion, and we will proceed from there depending on how active the regimen continues to be. Now, the third indication is follicular lymphoma. We are conducting a trial, have conducted a trial that's been presented to ASH before. It's been presented as an oral presentation by Nathan Fowler. It's the combination of Ibrutinib and Rituxan in treatment-naive patients with follicular lymphoma. At this meeting, we'll be presenting the data with more long-term follow-up. And basically, as the data has matured, we've continued to see an improvement in the overall response rate, which is high, 85%, with a remission rate of 35%. In addition, the safety profile continues to show that Ibrutinib is well tolerated, particularly in combination with Rituxan, and no new safety signals were identified. Based on this data, Pharmacyclics has embarked on a randomized phase 3 trial testing Ibrutinib and Rituxan versus Rituxan in treatment-naive patients with follicular lymphoma. And we expect to dose our first patient in the first quarter of next year. So to summarize, at ASH 2016, Ibrutinib was shown to have activity in combination in multiple indications, including marginal zone lymphoma, for which we've filed for FDA approval, in diffuse large B-cell lymphoma, where patients with relapsed and refractory disease were shown to have a high overall response rate with the lenalidomide, Ibrutinib, and Rituxan combination. And finally, in follicular lymphoma, we show long-term follow-up data which continues to show a high overall response rate and a long duration of response, and based on that, we'll launch a phase 3 trial. So that summarizes the activity associated with Ibrutinib in non-Hodgkin's lymphoma this year.